for these communities of their own situation and to also advocate for change in their situation.
So far, the Commission has done about 500 community profiles and plans to get to another 260 by January. Ms. Reed says the SDC hopes its work will be used to inform and direct the planning and development process in these communities. Traffic signals recently erected in the Old Harbour Town Centre will become operational within the next 2 to 3 weeks. That's according to Mayor of Spanish Town, Dr. Andrew Wheatley. The installation of the traffic lights is part of initiatives to reduce congestion in the town. Just recently, 2 bus taxi parks were constructed to provide adequate parking for public transport operators. Dr. Wheatley says that came out of talks with the taxi associations, which indicated that their greatest need was proper parking facilities. He urged the operators and commuters to make good use of the facilities. The mayor warns that there will be a zero-tolerance approach for these operators creating their own mini-taxi stands on the streets of Old Harbour. Those were the stories making the news today. For more information, please visit our website at www.jis.gov.jm. Stay with us. Jamaica Magazine continues.
At present, there is no vaccine available to protect against influenza A H1N1. However, there are everyday actions that can help prevent the spread of germs that cause respiratory illnesses like influenza. Take these everyday steps to protect your health. Cover your nose and mouth with a tissue when you cough or sneeze. Throw away the tissue in the trash after you've used it. Wash your hands often with soap and water, especially after you cough or sneeze. Alcohol-based hand sanitizers are also effective. Avoid touching your eyes, nose, or mouth. Germs spread this way. And try to avoid close contact with persons with flu-like symptoms. A message from the Jamaica Information Service, the voice of Jamaica.
Thanks for staying with us. Today, Jamaica Magazine presents the first in a series of discussions related to children and nutrition. It's part of a bigger feature we are working on about the topic. In today's segment, Enthros Campbell, our moderator, speaks with a group of children about nutrition-related diseases and their warning signs.
Hello, thank you for joining us for this very special program in which we're focused on childhood diseases. We are going to be talking to some of our own young children about this topic. Our guests in this segment are Kedisha Hudson from Micropracticing, Dimitri Clark from Alpha Primary, Rohan Atkinson from St. Andrew Prep, and Janelle Owens from St. Jude's Prep. Thank you for joining us on the program. Let us start by just talking about some of the diseases that affect children. What are some of these diseases that affect children that are related to nutrition?
Scurvy, which is lack of vitamin D. It's the bleeding of gums, and the mouth does not look proper because it's bleeding.
Right. Dimitri?
Malnutrition is when you don't get enough nutrition.
Janelle?
Rickets. It's a deficiency of vitamin D. It causes the legs to bend.
Right, Rohan.
Kwashiorkor, which is lack of protein in the body.
Right. So you'll name some diseases that can affect children or older persons too, huh? But that have to do with lack of nutrition or overeating, right? Are there any others that are related directly to malnutrition? Poor nutrition.
Obesity. Obesity is when you're overweight
Right.
to the limit that the doctor has to tell you that you're obese.
Very good. Ron, any other you can think of?
Diabetes.
All right, I want to ask you now, do you think that any of you here can be affected, can get diabetes?
Yes, because it doesn't matter about how old you are. It matters about how you go on about a healthy lifestyle.
Tanisha, do you think you can get diabetes?
Yes, I think I could get diabetes.
So tell me now, if a doctor were to tell you now that you have diabetes, what do you think would be some of the reasons that he would tell you that you have diabetes?
Don't eat any sweets. Can't eat starch. Because some people love starch, so they get addicted to it. So you have to stick to the foods that he give you. If you eat it, it can be worse. Diabetes can be worse.
Right. Think you're prone? Can you get diabetes? Think you're at risk of getting diabetes or become obese?
No, because I ensure that I eat healthy food, not unhealthy food. Like some people now, they eat unhealthy food, which is not good for your body. So they become obese.
You don't think you're at risk?
No.
What about you, Dimitri? Are you at risk for getting diabetes or become obese?
Well, kind of, because I'm eating so many sweets, but I'm still exercising a lot.
So you're at risk because you eat lots of sweets?
Yes.
What are you going to do about that? Can you do anything about that?
Yes, because I'm eating more healthy foods now, so hopefully I get over the addiction to sweet.
Ron, do you think you're at risk of getting diabetes or becoming obese?
No, I don't.
You don't think, oh, why aren't you?
Because I make sure I watch what I eat, make sure I exercise enough every day.
Watch what you eat?
Yes.
What do you eat?
Like apples, I carry at least one apple to school every lunchtime. And I make sure I don't buy a lot of food at school because I don't usually carry lunch to school unless it's the apple and a snack, and I drink some water.
So Janelle, what are you doing to ensure that you do not get any of these diseases?
Well, as a child, I know I have a lot of energy, so I try to burn off fat by exercising, and I try to make sure that I have all the nutrients in one meal, so I can have a balanced diet.
Good. Dimitri, would you be willing to do all these things that she just told us about to ensure that you don't get any of these diseases?
Yes, miss. Because I want to be healthy and I want to be fit for the future.
What would you say to other children who have the same problem with you, eating lots of sweets and pastries and so on? What would you tell them that they ought to do to ensure that they don't become sick?
Well, I would say...
Because it's not easy to stop eating the sweets, right?
Yeah.
Right? So what would you tell them?
I would say start eating like more tasty fruits like grapes, oranges and apples.
Khadisha, Dimitri, Janelle, Ron, thank you so very much for coming in today to share some useful information on good eating habits. And you're out there watching, I just hope that you will take these advice from your own peers and eat healthy, stay away from diseases.
Thank you.
Welsh's Heart Health Fund Run is this Sunday, November 29 at the National Stadium starting at 7 in the morning. It's a partnership of the Heart Foundation of Jamaica and Wysinco Group Limited. Come out and show your support for the fight to reduce the number of heart disease cases in Jamaica. Remember, don't be a victim. Exercise for a healthy heart today.
In sports, health, child welfare, mining and environmental sustainable planning, the Jamaican government is partnering with private sector and other groups for the development of the country and its people. Some of those areas of cooperation are highlighted next.
Bathed by the Caribbean Sea, lit by the tropical sun, clothed